Why do an intra and extraoral examination? It's a very important piece to a patient's visit. You can identify any variants of normal in the mouth and assess any undiagnosed or undisclosed medical conditions. This is an image of variants of normal. This is mandibular tori. It can be seen on many patients. It is just bony protrusions out of the bottom of their mouth. You can also see it on the roof of their mouth as well. Another image that you'll see is Fordyce granules, and you can also see these on the lips as well. This current image is showing it on the buccal mucosa. This is an image of a coated tongue. Normally it is a variance of normal, but this one is looking inflamed and might need medical attention. Our next image is of oral cancer, and this is the main reason that we do our intra and extraoral examination. Who should receive an intra and extraoral examination? Everybody. All of your patients that step into your operatory should receive this exam. Children, adults, geriatrics. Sometimes I might ask, have you ever received this type of exam? And you would be surprised by the answer. You always want to wear the proper PPE. This includes a disposable gown, scrubs, exam gloves, scrub cap, face shield, N95, and protective eyewear. As you can see, Sophie is wearing everything properly and is ready to go. You also want to make sure your patient is protected as well. They will be wearing their patient glasses and their patient napkin. Before you begin, you want to explain the procedure to your patient, what you'll be doing and how you'll be doing it, and you always want to get their permission before you begin.
So today we're going to be doing a head and neck exam along with examining the tissues of the mouth to make sure everything feels normal. I'll be palpating around your head and neck. Just let me know if anything is uncomfortable or tender. Is that okay with you?
For the appointment, you will wear the proper PPE, which includes 2 pairs of exam gloves. You want to do a general appraisal of your patient before you begin. You will give them mouthwash, and the intraoral extraoral examination does not have to be in any specific order. We'll start with the anterior border of the mandible, feeling the metalis muscle with a digital bidigital palpitation, the submandibular and the submental region. You'll be also feeling the occipital nodes, the temporalis muscle and the parotid gland, the masseter muscle and the TMJ. You will have the patient clench and open and close their mouth. You will then feel the sternocleidomastoid muscle, the upper lower deep cervical, their larynx and thyroid, palpating right and left lobe, and their supraclavicle nodes. You will then move to the back and feel their auricular nodes, the anterior and posterior with a bilateral circular motion, and their occipital nodes with a bimanual bilateral palpitation. With your hand on your patient's larynx, have them swallow, then move back to the anterior border of the mandible and have them swallow again. You will lay your patient back and ensure they have their patient glasses on before you begin. You remove your outermost exam gloves to move forward to the cursory screening. This is Sophie's exam kit. What she really needs from this for her examination is the mouth mirror and the gauze to hold the tongue. You always want to ensure proper lighting during your examination. To start the cursory screening, you're going to look at the vestibular mucosa, mucobuccal fold, palate, tonsillar area, uvula, tongue, floor of the mouth, gingival unit, and retromolar and endonculus areas. You're just going to look at these and look for anything out of the ordinary. Using one finger in a digital palpation, you'll feel the retromolar area and the maxillary tuberosity. This is behind where the second or third molars would be. You will start with the lips and the labial mucosa using a bilateral bidigital palpation. Then feel the frena on the maxillary and mandible. And then you will proceed to the buccal mucosa using a bidigital and bimanual palpation. As you can see, Sophie likes to dry her fingers off in between each time she goes back into the patient's mouth. While you're palpating the buccal mucosa, you'll want to locate the Stenson's duct. It's located next to the molars on the buccal mucosa. With one finger, you're going to use a digital palpation and feel the gingival unit, alveolar ridges, mucobuccal fold, and the vestibular fornix. You'll feel the floor of the mouth, the submantle and submandibular, the hard palate moving across it horizontally. Retract the lips and move them laterally. Retract the tongue with gauze and examine visually as well as digital compression of lateral, ventral, and dorsal surfaces. During this examination, you will also want to look at the soft palate, uvula, oral pharynx, tonsils, if present, and the tonsillar pillars. Have your patient lift their tongue so you can examine underneath. When your patient lifts their tongue, you will notice their Wharton's duct underneath. This one is a bit inflamed. Once Sophie is complete, she will set her patient up, note any findings in the patient's chart, and then talk about it with the patient. The intraoral and extraoral examination should only take about 5 minutes. It can be done in any sequence, but once you pick a sequence, you need to stick with that one in order to reduce errors. Thank you for watching. Enjoy.
No.